Hello everyone. Hello everyone. How is audio visual? Hello everyone. Is my voice clear? Hello everyone. Is my voice clear? Is my voice clear? All right. So a very good evening to all of you. This session was planned, but because of some technical issue, we could not complete this session last week. So before we go further, I want to just wind this up so that we are done with our week 1 schedule, that is vaccines and cold chain, right? Vaccines and cold chain. All right. So first of all, they ask you, so these sessions are just for the revision purpose, right? So I request you not to forget your original class notes which you made or you have printed ones, right? You should not forget, you should not ignore those notes. If any information extra you find here, just add it to your notes, but stick to your notes, right? So what all are live vaccines? So I have a mnemonic for you for live vaccines: enjoy a big meal party and rest in van, right? So E stands for enjoy. Epidemic typhus, nasal influenza, Japanese encephalitis, OPV and oral typhoid, yellow fever, BCG, measles, mumps, plague, rotavirus, rubella, and varicella. So enjoy big meal party, enjoy big meal party and rest in van. Yes, repeat with me: enjoy big meal party and rest in van. Epidemic typhus, nasal influenza, Japanese encephalitis, OPV and oral typhoid, yellow fever, BCG, measles, mumps, plague, rotavirus, rubella, and varicella, right? So these are mnemonic for live vaccines. This is topic number 1 from vaccines, which is important, right? They ask you which of the following is a live vaccine. Now this is a question: which live vaccine not contraindicated in pregnancy? Yes, everyone. Can you please write in chat box? Everyone, according to you, which vaccine is not contraindicated in pregnancy? Yes, everyone. What should be the answer according to you? Yes. So here the answer is yellow fever. Here the answer is yellow fever. All these vaccines are contraindicated in pregnancy except yellow fever. Now if I ask you a question, which vaccine not contraindicated in pregnancy? BCG, OPV, rubella, rabies. Although rabies is a killed vaccine, still rabies is not contraindicated. Any condition, rabies is never contraindicated because this is a life-saving vaccine. We all know there is no treatment for rabies available. Right? So only option we have is to prevent it by giving vaccine. Now let us quickly revise national immunization schedule. You all must have read it, and this must be in your notes. Okay, so at birth, OPV, BCG and hepatitis B. At 6 weeks, pentavalent, OPV, rotavirus, FIPV and PCV. At 10 weeks, we give pentavalent, OPV, rotavirus. At 14 weeks, we give pentavalent, OPV, rotavirus, FIPV second dose and PCV second dose, right? At 9 months, we give measles, rubella, Japanese encephalitis, vitamin A and booster of PCV. At 16 to 24 months, we give second dose of measles, rubella, second dose of JE, a DPT booster and OPV booster. Yes, everyone. Now at 5 years, we give DPT, At 10 years, we give TD, right? What is this? Tetanus and diphtheria, right? This small d stands for low dose or adult dose of diphtheria. At 15 to 16 years, we give TD. Now, this is National Immunization Schedule, right? Now, coming to BCG, right? Yes, everyone, please be with me. BCG is a freeze-dried vaccine. So, BCG comes as a powder, right? So, if this is the BCG vial, it comes as a powder, right? It comes as a powder. So, if it is a powder, it needs reconstitution. It needs reconstitution. What does that mean? Mixing it with a diluent, mixing it with a diluent. What is the diluent in case of BCG? Yes, everyone, diluent, everyone. It is normal saline. It is normal saline. So once reconstituted, it should be used within 4 hours, right? So this BCG is given intradermal. I want you to remember one thing. If anything is given intradermal, dose should be 0.1 ml. Why? Because when we give intradermal, it makes a bleb. And if dose is more, like if I am giving 0.5 ml intradermally, this bleb will rupture, right? If anything is going intradermal, the dose has to be 0.1 ml, right? Now, what is the site? What is the site? Site is left upper arm. Left upper arm. We all have a scar. We all have a scar. That is BCG. Now, I gave a question. What is indirect BCG? What is indirect BCG? We are giving BCG up to 1 year of age. But if I am giving after 1 year of age, I need to do Montague's test. So if BCG is given after 1 year, after doing Montague's test, it is indirect BCG. It is indirect BCG. Now coming to next slide. Now, this is very, very important to understand. It might not be there in your MCQ, but you should understand to solve other questions, right? Now, what is difference between OPV and IPV? OPV is given live, IPV is given killed. If anything which I am giving live, I will give it as orally. Here I will give intramuscular or intradermal. I will tell further what is difference between intramuscular and intradermal, right? So this is a cheap vaccine. This is a expensive vaccine, right? This is a expensive vaccine. Now beta, if I am giving something live, what if there is some mutation, right? So OPV may lead to vaccine associated paralytic polio, right? Whereas IPV will not lead to vaccine associated paralytic polio. It is easy to give orally. It is easy to give orally. So it is used for epidemic control. Whereas it is not used for, IPV is not used for epidemic control. Now, if I am giving someone orally, the vaccine is passing through the GIT, right? And here it is activating mucosa also, right? So local immunity is given by OPV, whereas local immunity is not given by IPV. I hope quickly difference between OPV and IPV is clear to you. Now one thing more I want to tell you, right? So we have 3 strains of polio, P1, P2 and P3. P1, P2 and P3. So we are giving P1 and P2 here in OPV, but whereas P1, P2 and P3 in case of IPV. So OPV is a bivalent vaccine, whereas IPV is a trivalent vaccine, right? Now, I hope this is clear to all of you, right? Please write in the chat box, is there any confusion here or should I go ahead? This is very important. Now coming to IPV and FIPV, right? So now I want to give IPV, but IPV is very expensive vaccine. I cannot afford it, right? I cannot afford it. So I said, my team, can you make a vaccine which is given in less dose? They said, sir, I told you one formula. Give intradermal. You have to give it 0.1 ml. I said, okay, then make it a fractionated ones, right? So FIPV is given intradermally 0.1 ml, whereas IPV is given intramuscular 0.5 ml, right? 0.5 ml. So we need only one dose of IPV, whereas I need two doses of IPV. When 6 and 14 weeks, I need IPV only one dose, 14 weeks. 14 weeks, right? So this was a previous year question of PGI. PGI, they asked in 2017 or 18, I guess, the difference between something related to IPV and FIPV. Now I hope it is clear to you. Now, difference between VAP and VDP. What is VAP? VAP is vaccine associated paralytic polio, whereas VDPV is vaccine derived polio virus, right? So VDPV is caused by type 2, or you can say P2, and VAP is most commonly caused by type 3, that is P3, right? Now this VDPV causes outbreak. So once there is a case of VDPV, it will spread to other kids, those who are unvaccinated, but VDPV will not be, VAP will not be spread, right? Where there will be no outbreak in case of VAP. Now, if there is an outbreak, then the kids must be shedding the virus in their feces. So if you go and take sewage samples, so sewage samples are positive, whereas in case of VAP, sewage samples are negative. Sewage samples are negative. Yes, everyone, can I go ahead? Please write in chat box, can I go ahead, everyone? Now, measles, rubella and JE, they are brothers. They are brothers, right? One brother is righty and another brother is lefty, right? So JE is given on left side, right? They both are brothers. They both are given 0.5 ml. They both are given subcutaneous. They both are given at upper arm. They both are given at 9 months. Everything is same about measles and JE. They are brothers. Only one difference. JE is lefty. How to remember? JE, right? So if I take mirror image of J, it will be L, right? So JE is given on left side. Another difference is I can give up to 5 years. Measles maximum given up to 5 years, whereas Japanese encephalitis is given up to 15 years, right? Now vitamin A, everyone knows, less than 1 year we give 1 lakh international unit. More than 1 year we give 2 lakh international unit, right? So at 9 months we give 1 lakh international unit. After 9 months we give every 6 months. Every 6 months it is given up to 5 years, right? So total 17 lakh international units given. Very easy. Now pentavalent DPT and TD, they both are given. Pentavalent and DPT 0.5 ml intramuscular on thigh, anterior-lateral aspect of thigh, right? Now pentavalent, it has 5 vaccines, DPT plus Haemophilus influenza B plus hepatitis B, right? Now what is this TD? This small d stands for adult diphtheria. Adult diphtheria. The small d stands for adult diphtheria. Now TT in pregnancy. First dose give as soon as possible. Second dose we give after 1 month. After 1 month, right? So second dose is given after 1 month. Now if the lady was pregnant within 3 years and she was completely immunized, like 2 doses given, then 1 dose is given. Then 1 dose is given. If more than 3 years she was pregnant, then 2 doses are given. Right? I want to tell you one thing also. Right? Here, if the lady is coming and she delivers on the way, so lady is in your hospital and she delivers on the way and she was unvaccinated, what to do? Give 1 dose. So whenever the pregnant woman is coming to you, give 1 dose of TD, and after 1 month, even after it is after delivery. Right? Now, vaccine not given under NIS, it is influenza. Right? Adult JE is recommended in some selected states. Now, vaccine given to 5th class boy under NIS. Yes, everyone, I want your answer here. Yes, everyone, I want your answer here. Yes, everyone, I want your answer here. What should be the answer here? Vaccine given to 5th class boy under NIS. It is DPT or TD? Influenza or rotavirus? Good. So here answer is TD. So when the question came in NEET, many students, they were confused by 5th. They thought 5 year and they marked DPT. So 5th class boy is roughly 10-year-old boy. Right? So at 10 years we give TD. Very good. Now coming to maximum cutoff. This is very important and very confusing. Now, so birth dose of hepatitis B, it is given after, if not given within 24 hours, right? You need not to give it after 1 day. Hepatitis B birth dose not given after 24 hours. Then OPV birth dose, if not given within 15 days, then no need to give OPV. BCG, pentavalent, PCV, FIPV and Rota, just mug it up, right? They may ask you these questions in any form. This is very important topic, right? So BCG, pentavalent, PCV, FIPV and Rota, they are given within 1 year. If after 1 year any unvaccinated kid comes to you, no need to give. Then measles, OPV, vitamin A. Measles, OPV, vitamin A, given within 5 years. DPT given up to 7 years. After 7 years, we don't give DPT. And JE can be given up to 15 years. This is very important. And they may ask you in any form. Now can you solve this question for me? 18-month-old unvaccinated kid comes to your clinic for first time. Which vaccine to be given? So 18 months, right? So 1.5-year kid. Pentavalent is not given after 1 year. So this is ruled out. BCG is not given after 1 year. This is ruled out. And here also BCG not given after 1 year. So this is also ruled out, right? So we have option OPV and DPT. OPV is given up to 5 years and DPT is given up to 7 years. Right? Now coming to strains. These strains, sometimes they ask you these strains, right? Sometimes they ask you these strains. So for BCG, yes everyone, can anyone tell me strain for BCG? Yes, any student who can tell me strain of BCG? It is Danish 1331. What about measles? It is Edmonston Zagreb. Edmonston Zagreb. What about mumps? It is Gerald Lynn strain. Yes, anyone? Rubella. What about rubella? Who will tell me about rubella? It is RA 27/3. What about yellow fever? Yes, everyone. What about yellow fever? 17D. Okay, varicella. Who will tell me about varicella? It is OKA strain. OKA strain. And last, what about JE? Who will tell me about JE? SA 14-14-2. Yes, very good. SA 14-14-2. Now side effects. Right? So these side effects, sometimes they ask you, sometimes, I cannot say this is very, very important, but like last year, I never expected for rotavirus, they asked that the answer is intussusception. The answer is intussusception, right? Okay, now let me write. What about OPV? It is VAP. What about BCG? It is osteitis, suppurative lymphadenitis. Yes. And disseminated BCG infection. Now, so among all, this rotavirus is very important. Okay, what about measles rubella? It is SSPE and thrombocytopenia, right? So you must be having the whole list with you in your main notes, right? So I won't waste my time in explaining each and every one, just the very important ones like rotavirus. This was asked in previous year INI set. Now coming to vaccine components. So first component in a vaccine is adjuvant. So why we give adjuvant? Why we add adjuvant in a vaccine? To boost immune response. Yes, everyone. Next is stabilizer. So we have this vaccine in a vial, and this vial is made up of glass. So what happens? The components of vaccine, they get stick to the glass wall, right? So this might decrease the vaccine efficacy, right? So stabilizers, they are added to prevent vaccine component adhering to the glass. Next is preservative. We add preservative to prevent contamination. Of vaccine, right? So what are the preservatives added? It is thiomersal. And formaldehyde. Now what are the example of stabilizer? It is lactose and glucose or albumin. Now after preservative, I have buffer to manage the pH, right? So buffer is added to control pH. Now next is antibiotics. So antibiotics are added to prevent contamination. Most common is neomycin. Most common antibiotic used is neomycin. Now coming to adult immunization. So this was INI set last year question. Now let us see adult immunization. I have a mnemonic for you. Please vaccinate man with A to Z possible route that helps boosting COVID immunity. So the mnemonic is please vaccinate man with A to Z possible route that helps boosting COVID immunity. All right. So P stands for pneumococcal. Yes, everyone, please be with me. Can you please help me? Can you please answer to? Can you please answer here? Right. So V stands for varicella. M stands for meningo. H stands for hepatitis A. Z stands for zoster. Yes, very good. And P, what about P here? Here P stands for HPV. What about R? Here R stands for rabies. What about T? T stands for TD. What about health boosting? Hepatitis B. And COVID is COVID, and here it is influenza, right? So adult immunization, this was asked in INI set. So these vaccines we give to a adult. Now next is, what are heat, what are cold, and what are light sensitive vaccines? So light sensitive vaccines are BCG and measles. That is why they come under amber color bottle. Can you see here amber color bottle here? This is measles and this is BCG, right? We are giving these vaccines in amber color bottle to protect from light. Now what about heat sensitive vaccine? So if recombinant BCG is there, then it is the most heat sensitive vaccine. OPV, then IPV, then we have recombinant measles, then we have BCG, and then we have Japanese encephalitis. Japanese encephalitis. What about cold sensitive vaccines? Hepatitis B, PCV, pentavalent, TPT, and TD. These are cold sensitive vaccines. Among these, this is the most important question they ask you. Which vaccine is most heat sensitive? It is recombinant BCG. Now, vaccine wall monitor, VVM. Everyone knows what is a VVM. So this is a chemical indicator which tells you about exposure of heat. It tells you about exposure of heat. This is made up of para-toluene sulfonate. They have not asked this thing till now, but they might ask you. This is made up of PTS. Now we have VVM 30. What does that mean? 30 means 30 days are required. So it indicates number of days taken by inner square to change when the temperature is exposed more than 37 degrees Celsius. Now we all know, so if the outer circle and inner square, if inner square is light, this is stage 1. If inner square is light, but as compared to stage 1, it is dark, it is stage 2. If inner square and outer circle, they are same, it is stage 3. If inner square is dark, it is stage 4. So after stage 2, we discard the vaccine. We discard the vaccine. Now, open vial policy. What is open vial policy? Suppose I am here in a sub center. I opened a vaccine, only 3 doses are used. What to do? Should I discard rest of the vaccine? This decision to be made according to open vial policy. So open vial policy, it allow reuse of vaccine vial. It allow reuse of vaccine vial. So what it does, it reduces vaccine wastage. It reduces vaccine wastage, right? So if you opened a vaccine, it can be reused up to 28 days. Up to 28 days. But its expiry shouldn't have passed. Temperature should be maintained. Vaccine vial septum should not be submerged in water. The VVM should be okay. Now, this open vial policy is not applicable for, yes everyone, can you tell me answer here? Open vial policy is not applicable for, yes everyone. It is measles rubella, it is BCG, it is JE, it is Rota, and COVID. And this is applicable for all other vaccines like DPT, TT, OPV, IPV, pentavalent, hepatitis B. Hepatitis B. Right? So this is open vial policy, very, very important. Please don't miss it. Right? Open vial policy is very, very important. Now shake test. Shake test is used for freeze sensitive vaccines. Right? So shake test is used for freeze damaged vaccines. Now, what is there in this shake test? So if you are suspecting any vaccine to be frozen, what to do? Shake it, right? So if the amorphous component, it settles down, then do not use the vaccine. But it is cloudy all over the vaccine, then use the vaccine. Important point here is it is for freeze damaged vaccines. Now diluent. Now there is one point about diluent. Let us quickly recall. For BCG, it is normal saline. For measles, yes, what is the mirror image here in measles? It is W. So distilled water. Distilled water. And what about JE? In JE, it is phosphate buffer. It is phosphate buffer. They ask you where to put the diluent. So in ice-lined refrigerator, diluent should be placed at the top. What if there is no space in ice-lined refrigerator? Then you may keep it outside at room temperature. But before administering the vaccine and diluent should be at same temperature. Right? They should be at same temperature. So this was about diluents. Now next is ILR. Next is ILR. So in ILR we place vaccines. They ask you which vaccine should be placed where. So suppose this is a ice-lined refrigerator, and here we have compressor, right? So every refrigerator, they have a compressor. AC, they have a compressor. And above the compressor, there is a basket. Here we place returned vials, right? Returned vials. Or you can say open vials, which were opened in the center, but they could not be finished. Now, this is the upper basket of ILR, and this is the lower basket of ILR. Yes, everyone, can you please reply me in chat box? Among these upper and lower basket, where we have less temperature. So in lower basket, here we have less temperature as compared to upper basket. So here in lower basket, I will not put freeze sensitive vaccines. Here I will put heat sensitive vaccines. So I have a mnemonic for you here, and the mnemonic is don't hurt people in room. Don't hurt people in the room. Right? So the is in upper basket. Room is in lower basket because manners outstand. Because manners outstand. So it is OPV, measles, BCG, rotavirus, TD, IPV, penta PCV, hepatitis B, and diluents. So diluents are placed at the top, right? And if you ask about vaccine, then vaccine hepatitis B should be placed at the top, and OPV is placed at the bottom, right? So this is ILR. Now, so this was all about the quick revision of vaccines and cold chain. Thank you so much for your patience. If you have any doubt, please write in the chat box. So we are done with two topics: vaccines, cold chain, and infectious disease epidemiology. right? So here the week one topics are completed. Do revise them. Okay, thank you, Par. Thank you so much. If anyone is having any doubt, you may please ask in the chat box. I am here for another 1 or 2 minutes. So anyone having any doubt? Okay, thank you everyone. Thank you everyone. So study well, right?